Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today I'm going to give y'all my opinion about the new RSV vaccines that are currently available for adults. So I can hear a collective groan across the United States as we talk about yet another new vaccine. And I hear you. I understand that we're all so vaccine weary in the United States. The recommendation so far has been for adults 60 and over to get this vaccine after a discussion with your doctor. So there are two vaccines available, one from Pfizer called Abrysvo and the next from GSK called Arexvy. They use tried and true protein unit technology. So this is what we've been seeing with the vaccines like the hepatitis B vaccine and the new shingles vaccine. So this technology has been around for a long time. RSV, or respiratory syncytial virus, kills really young and kills really old. So that's why this vaccine currently is being recommended for adults 60 and over. Normally, an RSV infection for a healthy person is relatively mild. Sometimes you don't even have any symptoms at all. But if you are 60 or older and you have heart disease, lung disease, if you're immunocompromised, if you're on chemotherapy, if you're frail and you live in a nursing home, those people should go ahead and get the new RSV vaccine. I want to be more specific. So if you have congestive heart failure, if you have COPD, if you have asthma, if you have something like rheumatoid arthritis or lupus, and you're on an immunosuppressant medication, even something like prednisone, 20 milligrams or higher for a long period of time, then I would consider getting the RSV vaccine. But for others that are healthy, I would wait. And this is why I would wait. So we've received some data. One write-up was in the New England Journal of Medicine, which is a very reputable journal. And the other one was on the website from the CDC, and I reviewed all of that data. And for both vaccines, the effectiveness was excellent. So the effectiveness against lower respiratory tract infection like bronchitis and pneumonia was 83% for the GSK vaccine, known as Arexvy, and the efficacy for Pfizer's Abrysvo was 89%. So that means if you get this vaccine, at least within the first season of RSV after getting it, you'll be very well protected against lower respiratory tract infections like bronchitis and pneumonia that's caused from RSV. And the data was even better for preventing hospitalization and death. So that was in the 90s. So we know that it protects really well, but my hesitation is side effects. Of course, with every vaccine, you always have to consider side effects and complications of the vaccine. And we have a very low threshold for tolerance of any side effect from vaccines because we're giving the vaccine to someone who doesn't have a disease or possibly is even completely healthy. So in patients that received the RSV vaccines, we saw a greater incidence of atrial fibrillation a few weeks after receiving the vaccine. And then also they saw a few more cases of rare neurological disorders like Guillain-Barré and something called encephalitis, which is swelling of the spinal cord in the brain. These are very serious side effects. They were very rare, but they did possibly see a connection between the RSV vaccine and those side effects. And there is a possibility that receiving the RSV vaccine and the flu shot together may increase some of these side effects, especially the neurological side effects. So another recommendation I have is if you're going to get the RSV vaccine, don't get any other vaccine with it at the same time. We just don't know how it cross-reacts with other vaccines at this point. Also, since the data shows a little bit better efficacy with the Pfizer vaccine, I would try to get that one. Although if you go to your doctor's office or the pharmacy and they only have the GSK RSV vaccine, just go ahead and get that one. I don't think the data is that much better. So far, we're hopeful that this RSV vaccine is a one and done type thing. We'll just have to see. We've often said that about vaccines and then have realized that efficacy really wanes with time. So I can't guarantee that this will be a one and done vaccine, but I think that's what manufacturers are hoping at this point. We'll just have to see. So to summarize, if you're an adult age 60 and over and you have a heart or lung condition or an immunocompromising condition, or if you're in a nursing home, go ahead and get the new RSV vaccine. And just a reminder too that I would get the RSV vaccine without any other vaccines at the same time. If you are healthy, I would hold off and just wait and see what sort of side effects we see long term. If you're going to get the RSV vaccine, I would try to get the Pfizer vaccine, but I don't feel that strongly about it. The data is just a little bit better on efficacy with the Pfizer vaccine. I hope that helps. Thanks for joining me.